There's so many things we want to achieve. A couple of the key things would be to raise awareness amongst allied health workers and anyone actually who's interested in attending on the role that they can play within so to empower them to understand that they can play a role in changing domestic violence situations. The feedback we get is that it's given them confidence, and no matter how skilled, we've had doctors, psychologists, social workers, nurses, youth workers, and all of them have reported that they've learnt something that they didn't know and have felt far more confident in working in the community. The diversity of participants in the programs is important. For starters, it's a great networking opportunity, and so the participants are educating each other on interventions and perhaps referral services, and it's also an experience for them where they can start seeing that a whole range of workers are dealing with this issue, so it's not just within their particular profession. So it's breaking down the workers' isolation as well. I've learned a lot from an Aboriginal elder in Mildura and Aboriginal people generally in the training of how to approach it and to accept the way and respect the way that they work within their communities. So they have a far different approach than what we're training. So to give them airspace and to educate us in how they would deal with their own people has been marvellous for me. It's been a real eye-opener. Some of the other challenges are actually putting their own, perhaps unknown at times, biases and prejudices, their values and judgments onto the situation. So the woman must leave. A man is always a perpetrator. I will never be able to deal with a perpetrator. They cannot change. So there's some of the challenges, but for me that's part of the benefit of the training, because building up the workers' strengths and helping them see that there are ways that other people can change it's a big challenge in our work, but it's a really rewarding one as well. What we hear a lot is just so much more about if it were to happen. Usually when we speak with them, it's not necessarily they're having new cases, but how much more confidence. I will ask about this. I do know that I am playing a role, and my small part is not actually a role of helplessness. It's very empowering for me and the other person.